Okay, everyone, you got a text message from me the other day regarding pacing. Let me explain that a little further as far as how I approach that subject. It's something that we need to implement in all of our treatments, and generally we do, but it'd be nice to give it more structure. For instance, there's a joke that says, I went to the doctor and said it hurts when I do this, and the doctor said don't do that, right? And it's supposed to be funny. We don't say don't do that, but we do say do that differently. And that's basically what pacing is, okay? Because when we say don't do that, that's feeding into fear avoidance behavior. When that advice is followed, then a person gets worse over time instead of better, okay? So in its simplest form, when I'm dealing with pacing, for instance, if a person asks something, or if I ask a person, well, how long can you walk before your back starts hurting? Okay, and if they say, well, usually I'm good for 20 minutes, but more than 20 minutes I start noticing pain. I'll generally tell them, okay, let's cut that in half. I only want you to walk for 10 minutes at a time, so make sure that after 10 minutes you can decompress. Generally, I say lay on your back with your legs and hips in a 90-90 position, but at least find a position of comfort. In a perfect world, that would be for 20 minutes because the body rebounds in 20-minute cycles. But what that should allow you to do is take several 10-minute walks during the day instead of one 25-minute walk in which you work into symptoms. So find out where your breaking point is, and then my comfort zone is about 50% of that. Some people go into 80%. My comfort zone is 50%. Sometimes you have to retest that boundary. So I say, let's do that for a couple weeks, and then test yourself. Test yourself in such a way that you can take a break at onset of symptoms. But what should happen in 2 weeks, you're going to have the same pain, possibly, but I would hope that you would experience that after 25 minutes, maybe 30 minutes. And that's how we improve. Just like an athlete would. If you want to run 10 miles, you don't start by running 10 miles, you start by running a mile, okay? So it can be done with duration, but also intensity, okay? And for instance, a person can get in and out of the chair and say, oh man, my knees hurt, okay? Well, you go to a lot of PT clinics and it's like, oh, if you're not good at that, let's do more of that. That doesn't go over very well. So what we do have to do is introduce concepts, words that maybe they're familiar with, like cross training, for instance. And before we even get to cross training, we might even address some body mechanics. And so first of all, I'd say, well, let's try that a little differently. Let's kind of stick your butt out a little bit, keep your knees behind your toes, and see if that takes a little bit of stress off. So body mechanics, I know that doesn't cleanly fit under pacing, but it's a pacing technique. So you start with body mechanics, but then you start explaining, okay, this is how we're going to make that better for you. Okay, we're not going to just have you do it the way you've been doing it because that hasn't been working. So what we're going to do is maybe during the evaluation we find out that, wow, the quads are a little bit weak, and we explain that, mechanically your quads should actually be stronger than your hamstrings, and we're not seeing that ratio. And so we're going to do some quad strengthening, and we know that body loading activities bother you a bit now. So we're going to do this in a gravity eliminated position. We're going to do this in an open chain scenario, kind of like a short arc quad or something. And our industry is, oh, closed chain. Well, closed chain is where we need to end up, but it's not necessarily where we need to start, especially if people have some sensitivity, okay? So strengthening some quads, and now they know this is why I'm strengthening the quads. And then you establish that okay, we can do some mini squats, from here to here, because you're not working into pain. So the top half of the range, we're going to do, maybe we will do some body weight stuff. Maybe we're going to give you something to hold on to so that your weight can be back just a little bit and take some stress off of the knees. But we can work the top half of the range. Now, that bottom half is really important because we know that people only get strong in the range that they actually work out. So we can't neglect the bottom part, but we know the bottom part is irritating. So we have some specialized equipment here that lets us work on that. We have, for instance, a leg press machine where you can lay down on your back and you can do, some leg presses into a deep squat position where we are recruiting glute muscles, and your glutes are really important. If we can get your glutes doing more of this, then it's going to take some stress off the knees, but we're going to start in a gravity eliminated position with a resistance that doesn't provoke symptoms, and then we increase that resistance, okay? And just so everybody's very, very clear on this, if you're delegating a exercise to a patient and you're an aide, you can never increase them just on your own, right? But you can always decrease things. So if they're doing deep squats on the suspension system to help unload, but yet that's still causing irritation, then it's like, okay, well, we can do a squat or a leg press laying down on the table. We may have to go back to that. So that's a step down. You can always take a step back with the patient, but you can't take a step forward without the therapist authorizing that. Now, there are some blanket rules that we all follow, and the therapists were encouraging to put this in their notes. For instance, once, if a therapist wants something done 3 times 10, well, that's our goal. You don't start them there the first day, maybe 1 set of 10, and then 2 sets of 10, 3 sets of 10. When they get to 3 sets of 10, and those last few repetitions are not a challenge and they're not causing pain, then our rule here is we can increase the intensity as long as we're not provoking symptoms. And so that's a general guideline that we all ascribe to. And so there's a green light on that, but it's following those parameters. So we're always dealing with pacing techniques. It should be incorporated into every single treatment that a patient receives here, but it should be reinforced at home as well, okay? And again, that has to do with addressing duration and doing smaller amounts of activity, but several times a day. Sometimes it has to do with the range of motion of the activity. Sometimes it has to do with the intensity of the activity. But our goal is to find a point of success, and that point of success is activity that does not provoke the symptoms that the patient came in with. And that's a question we should be asking a lot. When we're not asking that question and we're not constantly revising treatment protocols to take that into account, then I get negative feedback, in social media circles and things like that, saying they don't listen to me. Patients are telling us stuff, and more importantly, their symptoms are telling us stuff. And we certainly don't want to feed into the fear avoidance behavior by not doing anything, but we do want to constantly be revising what they are doing. And that, in general, is a pacing concept. This new code that we're dealing with also takes into account that we're helping people implement exercise strategies in a busy day. So that might mean not exercising all at once. It could mean that every time you come to a red light, I want you to do a few chin tucks, okay? Every time you brush your teeth, I want you to do some hip flexor stretching, Start connecting exercises to activities. Before you get out of bed in the morning, let's do a few wigwags. Every time you check your rear view mirror, I want you to do some pelvic tilts. So strategies where people can implement home exercises into things they're already doing, because what we find most of the time happens if somebody has to look at their watch and say, oh, I gotta devote 20 minutes to exercise right now. It just isn't done. And just part of the reinforcing this strategy of time management that we're building under this patient education code, it involves accountability to a certain point. So if every time a person comes in, you go over their exercises, are any of them bothering you? How are you tolerating them? Make sure you do these so that when you come back next time, we're going to progress your program here a little bit. And if you're not doing your home exercises, it's going to probably make you quite sore. Now, we can live with a little bit of delayed soreness after an exercise progression. We're trying to avoid a lot of delayed soreness that makes you not able to do much for 2 days. We really don't like that to happen. It happens, but we take every step to avoid it. And some of those steps are purely your responsibility, and that means doing your home exercises. So that's a lot of information, a lot of things you've already heard and but just try to keep in mind when we're talking about pacing, that's what we're talking about. And a lot of it overflows into terms that people are familiar with, like cross training and that type of thing. So keep those things in mind. Something that should be done on every patient visit, and it's something, at least with Medi-Cal patients now, we're billing for on every visit, so we darn sure better be doing it. Keep in mind, it's an untimed code, which means it's done in conjunction with everything else we're doing. But those themes need to be reinforced. We get better outcomes when we do it. People buy in. We're able to package information in such a way that patients will complete their progression of exercise because it all makes sense. Sometimes how we're packaging things now it doesn't make sense to people. If it hurts when I do that, why am I doing it more? You know, if it hurts when I go up a step, why am I going up an 8-inch step in therapy? You know, what we should be doing is going up a 2-inch step, you know, and then a 4-inch, you know, and progressing like that. So keep in mind that these types of progressions are important, and again, as we're delegating visits, these are the themes that need to be covered over and over again. But call me if you need, not call me, no, you can call me, but ask me if you have any questions about that. It's something we're going to continue